Hi, welcome to the Forge Men's Health Podcast, where we get real and cut through the noise about what it takes to transform and forge healthier men. I'm Dr. May, naturopathic physician, board certified in endocrinology, and the first one shirtless in a snowstorm just to prove a point. Alongside me is Mike Johnson, acupuncturist, Chinese medicine wizard, and man whose playlist has never been described as easy listening. If you love music that hurts your ears, he's your guy. Together, we dig into the science of hormones, metabolism, and performance, plus the messy, honest stuff, building discipline with motivation when motivation disappears, showing up when it's hard, and why community might be the most underrated health intervention out there. If you've been searching for something that's uncomfortable but honest, welcome home. So let's get after it. Today, I'm absolutely thrilled to welcome Dr. Aumatma Simmons to the show. Dr. Aumatma is a double board certified naturopathic endocrinologist and a renowned holistic fertility expert who has spent nearly 20 years helping couples navigate the complex journey to parenthood. She is the founder of Holistic Fertility Institute and the creator of the Restorative Fertility Method, an approach that boosts an incredible 85% success rate by bridging the gap between ancient wisdom and modern medical science. She's a two-time best-selling author of Fertility Secrets and Infertility, a celebrated TEDx speaker, and the host of her own award-winning podcast called Egg Meets Sperm. She's also the creator of a Fertile Foundation supplement line, research-driven supplements to support your fertility journey, and is the co-founder of Madre Fertility, the world's first smart fertility analysis and individualized guidance app. It's like having a fertility doctor and a coach in your pocket, guiding your fertility journey step by step. Dr. Aumatma is on a mission to change the conversation around unexpected infertility and empowers parents to look beyond the surface and find true hormonal harmony. Dr. Simmons, great to have you. Welcome.
Thanks for having me, Dr. May and Mike.
Yeah. Okay, so let's just dive right in. So
Yeah.
I guess first let's kind of set the stage and ask the question: Is there a problem with men's fertility? We often think when it comes to infertility, this is sort of a female issue, but is there a problem with men's infertility?
Everything's great. Just kidding.
No problem, right?
Anything but great.
Yeah.
Male fertility has been on a massive decline since 1970 if we compare to now. So in this last 70-year span, we have seen massive drop-offs in sperm count. That is the most measured. 70 years ago, they couldn't do motility and morphology, so we don't know. But I would assume that's also on the decline. So we are seeing what a lot of people don't seem to understand, which is fertility is a two-person problem. And the male factor has been ignored for so many years. And our culture kind of puts men to the side, right? Most men come to me and say, oh, I went to the fertility doctor. They said everything's fine. They said not to worry about it. And yet you're telling me I have a bunch of sperm issues. So what gives? And I say, well, the way that really conventional medicine has dealt with the fact that fertility is on a decline for men is to just change the parameters. If we just lower the bar, then they don't have a problem. And we keep lowering the bar. So that's where I see the problem being, is that a lot of men don't realize that they are contributing to the fertility problem. And they're being affirmed from the conventional medicine world that they're okay. They don't need to worry about it. It's not their issue. But we know better. And we see a lot of differences when men are becoming part of the equation, when they do take responsibility and accountability and do something. Things massively.
That's a great point. Now, just kind of put this in perspective for us, because I've heard a lot of statistics kind of thrown out there. what used to be sort of the normal for the cutoff for sperm counts was like 115 million or something like that. Like,
120 million. Yeah.
yeah, somewhere in that. Now it's like 20 million. Is that right? Yeah.
Yeah.
So
Sure.
you're right. We just keep lowering the bar, right?
Yeah.
Yeah.
Yeah. And
Yeah.
we're like 20 million is not even like remotely close to what we used to consider normal.
Mhm.
And so part of like, I don't think that this is a conspiracy or anything. I think it's just that because most of the doctors that are doing the analysis are in fertility clinics that will offer solutions like IUI or IVF,
Mhm.
it's very common to say, well, 20 million is not a problem if you're doing IVF,
Mhm.
right? So that's the part that's missing is if you were doing IVF, this is not an issue.
Yeah.
But if you're trying to conceive naturally, we have a very big problem.
Mhm.
And that no one's being told that. And they're not being told, oh, by the way, this is going to take a long time because we don't have great sperm.
Yeah. Well, I think it feels like we're kind of putting the cart before the horse here, in that, yeah, this is technically normal because we have ways to compensate for this, whether it's IUI or IVF, right? It's like, well,
Yeah.
you got bad motility, let's do some IUI, right? And that'll help. It was like,
Yeah.
well, why don't we get to the root issue of like, hey, why do you have bad motility and
Right.
lower sperm counts, right?
Mhm, mhm.
But obviously, that takes a lot more effort. It takes a lot more digging, and it's not a quick fix, right?
And most conventional medical paradigm is not created for that, right?
Right.
Like it's not created for a root cause analysis. It's created for, oh, you've got a problem. Here's the solution.
Mm-hmm.
Here's an injection. Here's a pill. Here's something to fix the problem that you have.
Right.
And the fertility world is no different. So I
Mm-hmm.
don't I don't think it's the doctors. I don't think it's bad intentions. I think it's just the paradigm that we live in that
Yeah.
there
Yep.
is not the awareness that, oh, there could actually be something going on under the surface
Mm-hmm.
that is creating the problem to begin with.
Yeah. I mean, that's the majority of patients we see, right? Or these are people
Yeah.
who have gone through the whole conventional paradigm and unsatisfied, or they're not getting answers to the questions that they're asking, right?
Mhm.
Because you're right, the paradigm is different. It's a quick in and out. Like, hey, here's a really fast solution for you. Take it or leave it. That's all we have. Those are the only tools that we have, and oftentimes that's just not a good enough answer, you know.
Yep.
And so
Exactly.
we tend to see those people that want to dig a little bit deeper.
Yeah. Yeah. I think we see a lot of people that are waking up to this idea of like, what is the root cause?
Mm-hmm.
And they're I feel like it's a little bit of an awakening. People
Mm-hmm.
are just done with the whole like fix it mentality and are like,
Mm-hmm.
no, but why? Tell
Mm-hmm.
me the why.
Yeah.
And when practitioners, doctors can't answer that question, then they go looking somewhere else.
Mm-hmm.
And my hope is that everyone asks that question before they even walk into the fertility clinic. Like, why aren't we saying, oh, I know we're talking about male fertility, but even on the female side, it's like, oh, you've had hormonal imbalances for 20 years. Like, let's work on those. I don't care if
Mm-hmm.
you're trying to get pregnant. Let's work on the hormone issues.
Yeah.
And when you do try to go and get pregnant, it won't be an issue.
Yeah.
Or for guys that are like, oh, I have zero sex drive. My testosterone's low. Okay, let's figure out why.
Mm-hmm.
Um,
Yeah.
so yeah,
That's
I think
a great point.
yeah, I think we're in the age where people want to know and they're no longer okay with just like the band-aid solution that's the quick fix.
Yeah.
Yeah.
It's funny. Like, we all have kids, and it's, if you've ever had a 3-year-old, you know, like, you get used to the but why, and you just keep going through it. Which for me was actually a lot of fun because
Yeah.
that's what I do in practice all day. People come in and go, well, why is this happening? Well, why is that happening? And it's like that was a fun experience. When I know a lot of people, when they have 2 and 3-year-olds asking that question why all the time, it gets a
Yeah.
little bit of annoying, but for us, it's just another day at the office, right?
Right. Yeah. My 7-year-old still does that, by the way.
Yeah,
He's
true.
a curious little mind. It's
That's
like, Grandpa,
good.
why?
That's good.
Why?
Yeah, I tell my
Yeah.
kids all the time, just be curious. Curiosity will lead to a lot of fun conversations.
Mm-hmm.
It's so true. My 13-year-old was like, but why did World War II happen? An hour later, he's like, that's great. But why did this happen?
Mm-hmm. Yeah, that's fun. So I've heard you mention the term subfertility a lot. Could you explain to our listeners, like, what do you mean by that?
Yeah, I think infertility is sort of the assumed definition. And the
Mhm.
definition in the Materia Medica is like you've tried to conceive actively for 12 consecutive months. And if you're still not pregnant, you are quote unquote infertile. However, there's this 12 months is a long time to keep someone keep trying, keep trying, keep trying.
Mhm.
And it's a very emotional roller coaster when a couple is trying to be like, oh, this month, no, not this month. Oh, this month, no, not this month. And mostly it's the woman bearing the brunt of that emotional journey. But I've seen a lot of men describe, like, I'm over it. Like, I'm done with the trying.
Mhm.
And I'm done with the now, sex now, 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 now.
Mhm.
And it becomes exhausting very quickly. The thing that was supposed to be fun becomes a chore, and that like we don't want sex to be a chore. That's the worst case scenario.
Yeah.
So I think that if we normalize this idea of subfertility, it's not a medical condition. It's just something is not happening as quickly as it should. And if instead of waiting till that diagnosis, you actually start taking steps to figure out why your sex drive is low, figure out why your hormones are out of whack, figure out why you have PCOS, figure out all the underlying factors, you actually have 12 months that you could be working on all of those things before you get to the point of getting a label that says infertile. And infertile just has such a definite, like, you're never going to conceive. When in reality, like, most of those people will go on to conceive unless they have a genetic anomaly, they have fallopian tube blocks. Even those people will probably end up having babies. So it's very, the people that want to have children are most likely going to have children with some support sometimes. But that just the word alone has such a negative energy to it. It's like, well, if we thought about it differently, if we didn't think about infertility as a diagnosis, but as the starting point of a symptom that is pointing to other things, like, hey, if you're not getting pregnant, there's a whole bunch of things that could be going on. And we could address those things without any level of diagnosis. You don't need a label to work on your gut health and your blood sugar imbalances and your hormone dysfunction. All of those things are addressable without a label of any sort. So
Absolutely.
I'm for us getting away from these labels and just saying, like, yeah, things are not happening. Why aren't they happening?
Yeah.
And move forward.
Yeah,
Yeah.
I think it's a great point. We do this a lot in sort of functional, integrative, naturopathic medicine, right? Where, the standard sort of process is like, let's take, for instance, diabetes. Okay. So it's like, well, we'll just wait until your blood sugar, your A1C hits 6.5 before we actually start treating it, right? It's like, well, at that point, we already know this process has taken 10, 20 years or so
Yeah.
to get to the
Yeah.
point where they're at. This dysfunction is a spectrum. It's not an on-off switch, right? It doesn't mean like yesterday you didn't have diabetes, today you do have it. It's a process, right? And I think infertility is kind of the same way, or subfertility could be the same process here. And we start, thinking about dysfunction as a spectrum and not an on-off switch, then I think we may start to get to these issues a lot sooner then.
Yeah. Yeah. I had this guy, I'm thinking of this guy, like 42 years old. He came in, we did some basic blood work, which is our first step. And his liver enzymes are off the charts, like the highest that I've ever seen, to the point where I was a little scared. I'm like, you need to go to your primary care with this. I'm not touching you till you figure this out. And he goes to primary care, 2 different primary care doctors that are like, yeah, you're fine. We'll just keep an eye on it. I'm like, keep an eye on what? Till he needs a liver transplant? Like, I'm
Right.
confused what we're keeping an eye on.
Mhm.
So I'm like, no, you go back to them and push for an ultrasound, an MRI, something. And he comes back and he's like, oh, they told me I have non-alcoholic fatty liver disease.
Mhm.
Now what? And I'm
Mhm.
like, that's it? So they just leave you hanging after the diagnosis?
Yeah.
And he's like, yeah, they pretty much told me to come back in 3 years. And I was like, what? You can't, no, that's not functional. That doesn't make any sense whatsoever.
Yeah.
So they're basically telling you in 3 years you'll probably need a liver transplant. So come back to us then and we'll put you on a list.
Yep.
Uh,
Yeah.
so
Unfortunately, that's a pretty common, scenario. I
I
see
could
that
not, I can't
often as
believe
well.
it.
Yeah.
I cannot believe it. So luckily he came back and he was like, so is there something else you could do? And I'm like, yeah,
Mhm.
there's a lot we can do.
Mhm.
And 3, 4, 5 months later, his liver enzymes are totally normal.
Yeah. Nice. Nice.
Yeah. So
And I
I'm
say
like, it's mind-boggling to me that none of it is concerning until, oh, we got to cut it out. We got to do something major to fix the problem, but we could have addressed it way sooner with simpler things.
Mhm.
Yeah.
And I worked with Dr. May. You're talking about the timing thing. It's so true. Because when we were trying to get pregnant with our first, I worked with him and I remember being so frustrated. I would like look at the clock and I'm like, okay, we have these days in particular. And the stress that created, like the stress hormones that came from just, I have to plan for this moment, no pressure, but like this is the day,
Oh yeah.
it was just awful. And it turned into like, you have to set your appointment on your calendar, which is not how it should be at all.
Nope. And that's like men hate it. The pressure is actually I know we're going to get into this, but the pressure, I believe, is actually one of the reasons why the sex drive goes down. So we see it in fertility where guys are like constantly like, I need to get higher testosterone. I just need more testosterone. And I'm like, you don't need more testosterone. You need a shift in attitude that has more to do with what you're feeling from your partner when you guys are in this process of trying to conceive. That has nothing to do with your physiology. Your labs are completely fine. You're not in the dumps. That's not the issue. And he's like, what? Really? And I'm like, yeah. How's the pressure? And he's like, oh my God, make it go away. Please make it go away. Make her stop. And I'm like, okay, we're going to do that. We're going to make her stop pressuring you to have sex only when she's ovulating. And one of our techniques is flip the script. So the guys learn how to understand her hormones, where she is when she's ovulating, and how to tell that on a basal temperature chart, and on urine testing. So he can look at her stuff, know when she's ovulating, take charge, and not be in the reverse situation where she's like, come on, time to have sex. Why aren't we having sex?
Oh, I love that.
And the flipping the script is almost always it. Like he comes back, he's like, thank you so much. We're great now. We have so much fun now. And she's like got to be not in the driver's seat of the fertility journey.
Yeah.
He is like, I'm done trying to be on the sideline, not knowing what's happening. So he's got the education to know when it is that she's going to ovulate, and boom, done.
Wow. That's
And
very
guys,
cool. That's empowering. Yeah.
Yeah, it is.
Yeah, they love it. They come back, they're like, oh my God, you changed our sex life.
That's awesome. I love it. Oh, that's
So you were talking about subfertility. I was curious, like, what's the etiology, like the contributing factors you think they're leading to this? Because we've seen such a decline over time, and it's really hard to kind of sometimes put your finger on, like, is there a why? Why is this happening? I'd be curious what your perspective is.
Yeah, I think a lot of it for on the male side, I think so much of it is toxins. And they're coming from all directions. The toxins that are related to our environment, like BPAs and phthalates and things like that. Then we have toxins that are self-imposed, which are things like putting the laptops on their laps. They're not
Mhm.
meant to be on the lap, even though it says laptop.
Mhm.
Uh, it is the things that we don't realize. There are so many of our guys have two cell phones, not just one. They're like, oh, I got my one for work and one for home. And so this guy's walking around with two cell phones in his pocket, right where his testicles are. It's like, yeah, that's probably not great,
Well,
right?
we
Like,
actually have studies on that. What is it
yeah,
like? Within 20 inches of the genitals is associated with Leydig cell damage, which are the cells that make testosterone. So we see a reduction in testosterone when guys have their cell phones within 20 inches of their testicles.
yeah,
Like, whoa,
yeah.
everybody does that, you know?
Everybody does that. And um yeah, I think so. I think that there are the lifestyle factors. And then I would add to it, like I wasn't aware of this, but more and more my co-founders in my startup are men in their mid 30s. So I hear about they're like, "Oh my God, all of my friends. Tell my friends."
Mhm.
Right? And they're constantly like coming up with things that I've never heard of, like zinning. Do you know what that is?
No.
It's like some sort of nicotine thing that
Oh, yeah.
is,
There's in yeah, patch things that you can put
yeah,
in.
I
Yeah.
don't really know. and
Mhm.
and they're like, "Oh, all the guys in." And I'm
Yeah.
like, "What? We're not asking that. That's
Yeah.
not anywhere on my forms." I'm like, "What is zinning?" They're like,
Yeah.
"Oh yeah, you don't know about that, doc? You should really know about that."
Yeah. Yeah. It's a
And
massive amount of nicotine, isn't it?
yes,
Yeah.
yeah. So it's like it's the things that are becoming popular that aren't like
Mhm.
we ask like, "Are you a smoker?" And they're like, "No." But they're not telling us, "Oh, by the way, I use the Zyn patch 8 times a day," or
Right.
whatever it is.
Yeah.
It's like,
Yeah.
"Oh, crap." So, like, nicotine is a really big factor. It continues to be a factor that
Mhm.
I think a lot of people are not aware of when they're talking to practitioners. They're just like, "Oh, yeah, it's a Zyn. It's not nicotine. It's not a cigarette." So they're not disclosing it. Yeah, it's still going into their bloodstream. And nicotine has 7,000 studies on how it affects fertility negatively,
Wow. That's
I
a
didn't know
lot.
that.
7,000 studies.
How does
And there's
how
not
does
a
it
single
affect the
one
how does it affect fertility? Do we know? I'm
on
assuming
every
with
single level. It,
yeah.
it decreases sperm count, quality, it decreases egg quality, increases inflammation in the body, which is then going to cause issues with implantation. It's going to cause issues with embryo development. So every stage of fertility is disrupted by the exposure to nicotine. Yet the number of people, now that I ask everyone about the zinning, I'm like, oh crap, this is like a way bigger problem than I realized because even our very like well-educated clientele that think they're doing everything well, and then they're like, "Oh yeah, yeah, I use Zen. What's wrong with that?"
Yeah.
I'm like, "Oh my God, no."
Yeah.
And then similarly, like marijuana, I think that's another lifestyle thing that we don't talk about enough, and alcohol. So I think for male fertility specifically, I think that so many of those factors are happening. And then we have underlying gut inflammation, gut bacteria, which then leads to or correlates to reproductive microbiome. So we're seeing a lot of like repetitive issues on the male side that just are playing a major role in male factor issues.
Yeah.
Sorry, and then the last one I'll mention, just because it's becoming a big question mark in my mind of why we're not dealing with this, is the number of men that come in with very low sperm morphology. You're usually around 1%. Those, to me, instantly, I see 1% morphology, I'm like, you're getting a workup for varicocele. Like, go to your urologist, go get that thing looked at. And they come back and they're like, yes, I have a varicocele. The urologist said not to worry about it. I'm like, what? There is documented research that varicoceles do not lead to good sperm. Did you tell him you were trying to conceive? Yeah, doc, totally. Told them that. I'm like, okay, let's find you a fertility specific urologist who will back me up and say, you need to get surgery. There's not a roundabout for a varicocele. It needs to be addressed. And that doesn't automatically mean your sperm will get better, but with surgery and like post-surgical support to help support the sperm production, your sperm will get better. So that to me is like, what, in what world? Why are we starting to tell men that these are not issues anymore when it's always been an issue?
Right. That's a great question. Like for me, I see a lot of men with low testosterone, and especially in their 20s and 30s that shouldn't have low testosterone. And so our conversation, which applies a lot to the infertility part too, is, why do you have low T and you're so young? And it usually has to do with some of these endocrine disrupting chemicals, like you're talking about, the PFAS and phthalates and pesticides and BPAs and all those sorts of things. And I talked to him about how it's a double prong like hit on you. It affects your brain, so your brain's ability to send the signal to your testicles to make testosterone. And then it actually affects the testicles themselves, because the testicular artery is very low pressure artery. And so that makes the testicles really sensitive to any sort of oxidative stress, no matter where that's coming from. So if it's coming from, thermal stress because you're putting your laptop on there, or it's coming from these endocrine disrupting chemicals or microplastics or radiation, any of that stuff is going to affect testicular health, which is going to affect your testosterone levels and your sperm count and morphology too. So a lot of overlap there, but that's the problem, is we're getting hit from a lot of different angles, right? And so it's hard to just kind of, you can't just pinpoint one thing. You have to approach this from, multi, factors, which is, it can get challenging.
Yeah, absolutely. I think like the young men epidemic of low testosterone is also, it is an epidemic.
Absolutely.
It's an interesting situation because a lot of those men will go to a doctor who will say, oh, got low T? I have the solution. Let's give you a testosterone patch, pellet, whatever. And they're not having the conversation of what this is going to mean on their long-term fertility. And I don't know about you, but a lot of men in their 20s and 30s are like, I'm not thinking about that. I don't care if I have a kid. Just fix my testosterone. So unless they have a doctor who is like, absolutely not, we're going to leave that option open for you, they're going to be on testosterone and come to me in their 40s and be like, what can you do for me? And I'm going to look at them and be like, this is going to take a very long time, and your partner does not have the time. She's 42. She needs your testosterone online so that your sperm production is online. And if you don't have sperm, we're looking at a year to 2 years to fix your sperm production. Unfortunately, she's going to be done by then. Like her time window is closing. So we're seeing a lot of that on the back end of men that were not told, men that did not have those conversations with their doctors, did not get given alternatives, and like, unfortunately, weren't thinking about it then. They're like, I don't have a partner. I don't care if I ever have kids. It's not a priority for me. So if that's the energy that they had in their 20s and 30s, the doctor was like, well, yeah, sure. Let's give you the tea. It's not a problem.
Yeah, this is a situation I see a lot, and I'm not a fertility specialist, but I see this situation a lot. Guys coming in their early 30s to mid 30s, they've been on testosterone already for 10 years at this point. And they're
Wow.
like, okay, like we want to have kids now. I'm like, and we want to do it in the next 3 months. I was like, oh, we got
Like,
to back
oh,
up. Like,
that's happening.
we need to change your expectations here because
Yeah.
if we can get things back online, it's going to take some time,
Yeah.
and so I
Yeah.
feel like it's bordering to malpractice now to
Yeah.
be able to provide testosterone replacement for these young guys without having a conversation of fertility.
I agree. I feel like it should be really testosterone is not to be used in men under 40 who are not done having children. The same way
Mhm.
hysterectomies are not to be thrown out women who are not done having children, right? Like
Yep.
that should be a common sense thing of like, yeah, we just don't do it as a practice because we don't know what you're going to want in your future. You don't know what you're going to want in your future.
Yeah.
And the other thing I've seen is a lot of men are under the belief they've been told by their doctor, oh, it'll take 3 months to get that back. Don't
Hmm.
worry about it. It's not a big deal. The effect on fertility is not a big deal. And unfortunately, like I'm looking at them like, you have zero sperm production. That probably went away years ago. And no, it just doesn't magically click back and turn back online
Hmm.
when you have shut that signal off for so long.
Yeah. Yeah,
So,
that plus all the other stuff we've talked about, right? All the endocrine disrupting chemicals. I mean, you throw something else like COVID in there, which we've seen drops in sperm counts,
oh
with
yeah,
COVID. It's
yeah,
like there's just so many different factors that are playing into
yes,
this. Like
yeah,
yeah, it can be overwhelming, I'm sure. And I'm sure you see
yeah,
a lot of those patients, those who are, they've exhausted all those different options and they're overwhelmed.
yeah. And they're like, I feel like by the time they come to us, they've tried a lot of things and it doesn't always click into place because
Mhm.
uh there it's so many things as you mentioned earlier, like you really need this like holistic approach. And guys will come and be like, I've changed my diet. I'm a carnivore. I do this diet. I do that diet and nothing's working. And
Mhm.
I'm like, yeah, diet was good 10 years ago. It's
Right.
Mhm.
no longer adequate.
Yep.
Uh,
Yeah.
we're gonna need a lot to get all of the endocrine system working together in order to get the solution that you want in the time frame that you want.
Yeah. So I think that's a great segue here. So we've talked about, one, is there a problem? Obviously, like, yes, there's a major problem. And what are some of sort of the etiologies, the causes, contributing factors, that sort of thing? So I'm sure plenty of people are out there right now going, okay, just tell me what I need to do. Like, what are some treatment strategies here? So
Sure.
if you had someone come in with these questions, what are you sort of shooting them towards first? Like what kind of direction are you moving first?
I think there's a few things that are very easy to do for male factor that honestly like anyone could start doing today. One Number one would be get rid of all of the plastic and petrochemicals.
Hmm.
So BPAs, BPF, BPS, whatever, all the BPs,
Hmm.
bisphenol compounds.
Hmm.
Uh, and and like don't make excuses for things that are sneaking in. So going to Starbucks in the morning, getting your coffee in the plastic lined cup. I'm sorry, that level of exposure to plastic is not helping. The microplastic that is in the toothpaste that you brush your teeth with to get all the extra whitening
Hmm.
is microplastic.
Hmm.
So really getting like it's kind of a massive list. It's overwhelming when you start thinking about it, but you just go from one little area of your home to the next, if you got rid of all the bisphenol compounds and phthalates. Phthalates are funny because men don't usually care, except they care to smell good,
Mhm.
and they care that their cars smell good. So
So
unfortunately,
true.
you're breathing in these air fresheners that are in the car that are in a very small enclosed space that are actually very much negatively hitting your endocrine system.
Mhm.
So you have to get rid of the stuff that smells good. Stop with the
Yeah.
cologne, stop with the beard aftershave stuff that smells good. There are lots of natural alternatives. We're not going to leave you hanging. Like, you can still have your good smells, just do it naturally.
That's
Uh,
true. A good
so
resource I found too is the Environmental Working Group. They put out a list of endocrine disrupting chemicals and how, like, based on the room in your house, where some of the high exposure rates are and how you can reduce those exposures. So
yeah,
it's a great tool.
yeah, yeah, awesome. So I think that those are like kind of easy things to do. The next I would say is pretty much along the same line, switch to cotton boxers.
Mhm.
Switch away from the briefs, more space is better.
Mhm.
Uh, and ideally it's cotton. So the polyester fabric, especially so close to the testicles, is not great because you are absorbing that through the skin.
Yeah. Don't
So
those have PFAS in them? Or a
yes,
lot of those? Yeah.
yeah,
Synthetic
yeah,
materials. Yeah. Yeah.
yeah, yeah. They're not great in any shape or form, but at least I feel like it's kind of hard to get rid of all the polyester.
Mhm.
We're in an age where almost everything is polyester.
Yeah.
But if we can get rid of the stuff that's closest to our reproductive organs, that's a really great starting point.
Yeah. Good point. Mhm.
So that I think that's really easy to do. Um, ice the balls. This is
Yes.
a really great tool that has amazing amounts of research
Mhm.
that shown to improve count, motility, and morphology. It's one of the only tools that is shown to improve count, motility, and morphology in 6 weeks. So
Yeah.
if you use it consistently, and generally the recommendation is ice under the testicles like once or twice a day for 15 minutes. And if you go at that hard in 6 weeks, you could see like very good potential improvement.
Nice.
So, and it's free, right?
Yeah.
Like, it doesn't cost anything. Grab the peas,
Yeah. Yeah.
get over it.
So it's interesting. I knew you would bring this up, so I actually did some
Yeah.
digging, and I found some research that said daily cooling for 8 to 20 weeks significantly improved sperm parameters across the board,
Yes.
64 to 83% in men. So that's pretty
Significant.
massive. Yeah,
Yeah.
that's
Yeah. I
great.
don't know of a supplement that does that.
No way. Yeah, no way.
The
And which is
only,
interesting too, because a lot of the guys, if they're trying to detox from these chemicals, they're going to hit the sauna, right? Which
Mhm.
again is that thermal warming, that thermal stress there too. So, what would you recommend for a guy that's wanting to hit the sauna, but at the same time, like, obviously wants to reduce that
aware.
stress? Yeah.
Yeah. So we will potentially use saunas if they're not actively trying yet. So if he can pause on the trying for 8 to 12 weeks,
Mm,
great. Go ahead and use the sauna. Bring an ice pack into the sauna with you. It's going under your testicles while you sit in the heat.
nice.
So you're keeping the testicles cool while you're getting the overall benefits to your body.
Mm, mm,
And there's actually, if that feels weird or whatever, there's a company, I forgot the name of it. You can find it on Amazon. It's a company that it's basically like an ice pouch. So you stick an ice pack into your boxers and then it just holds the ice there.
nice.
So you can wear something like that if you're feeling weird about holding an ice pack under your balls, then there's that.
You'll really look like you're packing going into the sauna with the other guys.
um
Mm,
so that I think it's super low hanging fruit in terms of what you can do actively that is going to have a pretty huge ROI. The only caveat I'll say about icing the testicles is that what they have noticed is when you stop doing it, all of the sperm parameters will crash.
Yeah.
So if you are using this as your main modality, then you're committing to using it until she's pregnant. Because then you can stop, right? But you don't want that like huge drop off out of nowhere because you stopped icing. So that's the only caveat, but I think it's my favorite technique. It's honestly like real, like the benefits for the cost. Like I can't give you a supplement that will do that.
Yeah, absolutely.
So yeah. And then I think the last thing I will say is focus on optimizing your sleep circadian rhythms because testosterone and male hormones are really circadian driven. There's a significant impact when someone is aligned to their circadian rhythm. And we'll see this in night shift workers. We have a couple of doctors who work night shifts right now, and they're like, well, what do I do? And I'm like, I honestly, I don't know what you can do. I don't have a great solution to outsmart your body that knows that it's time to go to sleep, but you're awake. So those are very tough scenarios to work with. If that is not the case, and like obviously doctors, they have a interesting, unfortunate situation. And even those guys, I'm like, just change your schedule, right? Like take the temporary hit, 12, 16 weeks, take the hit, and then you can shift back to your night shift after she's pregnant. So you could do it that way. But then there are guys that they're optionally doing it, right? Like they're staying up all night because they're techies that work best at night or are on a weird sleep pattern and are not focused on getting sleep. We had a guy that worked at kind of a really big startup, and he's like, I work 80 hours a week. I can't sleep. I get 2 hours of sleep a night. And if I do more than that, I'm not functioning well. And I'm like, you can't function on 2 hours of sleep. There's nothing, there's no amount of supplements I'm going to give you that is going to compensate for the fact that you're only getting 2 hours of sleep. And he's like, but I'm good. I feel fine. I'm like, yeah, no. Let's do some cortisol testing. I will show you you're not fine.
Absolutely. And sleep, it's just like, it's the biggest obstacle most of the time. It's just kind of where the cascade starts to happen, right? Like Mike, we saw this a lot in, working in Alaska and seeing guys who were, up at the slope or, they worked in a mine and they had this rotating schedule. And invariably within about 6 months, they gained about 20 pounds. They started developing sleep apnea. Their testosterone would tank to 300 points. Like everything just like, as far as their health went, just went the reverse direction in a really short amount of time. So it's like the fastest way you could just wreck your body.
Yep.
You could actually look at it by a calendar, and when September came in Alaska, everybody crashed at the same time because they've been up for 3 months. And they come in and like, I don't know what's going on, but I have no energy and I feel down. I feel under the weather. I'm like, have you slept? I'm like, no, I was chainsawing at 3 a.m. every night for like the last 3 months. And you're like, well, maybe we should work on your sleep. Perhaps.
Yeah. Cool. Well, I have a question for you, because I just saw this new research that came out last month in March on post-meiotic sperm senescence. And so this study it was from the University of Oxford, and they revealed that sperm stored in the body for too long, which was abstinence more than 48 hours, undergoes rapid DNA decline or decay, which kind of goes against what we've thought for a while where you needed like 2 to 7 days of abstinence to
Yeah.
increase, your sperm count and all that. So I'm kind of curious, what are your thoughts on that if you've seen that study?
Yes, I have seen that study. Really interesting because the guidelines, even for semen analysis, is 3 days of avoidance
Mm-hmm.
before the test. So I think that this is going to change the guidelines quite a bit.
Mm-hmm.
And for us, I feel like we're not suggesting abstinence or like everyday sex. People always ask the question, right? Like, when do I have sex and how often?
Mm-hmm.
And I'm like, if you were not trying to conceive, how many times would you have sex? They're like, oh, 4 times a week. Great. Keep doing that.
Mm-hmm.
Right. So you're not changing from what is your natural body's rhythm. And of course, there's going to be natural changes because as people's sex drive go up, they're going to want to have sex more often. So what we've noticed is instead of Uber controlling when couples have sex, our guideline has always been you're going to take a pause for a little bit while we address all of the underlying factors. Then we lift the restrictions and you get to go have fun. And you're having fun based on your body. You're not forcing it. You're not having sex more than you feel like. You're not having sex less than you feel like. You are going with each other's rhythm. And if you can do that, most people come back within 3 cycles. They're like, we're pregnant. What did you do? I don't know. I wasn't even sure I was ovulating yet. Like, yeah, I know. That's always the case, is like, because the sperm hang out can survive for up to 5 days, it really doesn't matter that much. So all of this like overemphasis that our culture has created on the timing and the frequency, like our bodies have already been created to accommodate for that.
Mm-hmm.
The fact that the sperm can survive for 5 days, you're having sex every 2 to 3 days, guess what? You're good.
Mm-hmm.
Stop overthinking it. and like just let it be. So it is, when we think about natural conception, I think that we really, like, if we do away with all the recommendations and just listen to our bodies, then we see a lot of different results. And I think so much of that pressure goes away because you're no longer needing to perform. There's no expectation. You're taking away the kind of mental energy that all of the TTC journey takes,
Mm-hmm.
and instead putting all of that energy into optimizing for your connection.
Mm-hmm.
And when you're optimizing for like, oh, we want to create this child out of love, and we're focused on each other and how connected we feel, and when we feel, we're not like putting ourselves in this pressure cooker of, oh my god, it's gonna happen this cycle. It's like, just let it go. Let the
Yeah.
timelines go,
Yeah.
and
Yeah.
boom, you're gonna get pregnant faster than you can imagine.
Yeah, isn't it funny how that happens? Like we stress ourselves out, which is going to be like the opposite of what we want to do to our bodies, is create more stress, right? Because then you were like fight or flight. Now we're shunting resources away from fertility to stress response, right? And so it's just
Yeah.
counterproductive. So I think
Totally.
that's a wonderful point.
And from a personal story, I actually worked with Dr. May. I'll share a little bit personally. And our first child, it took over a year. And it was a whole thing. And it's funny, I'm in Chinese medicine, and I thought a lot of this was woo woo. He's like, well, are you putting cell phones over your testicles? And I'm like, that's the most ridiculous thing I've ever heard. Like, and are you plastics, and like, oh, you're riding your bike all the time. And I'm like, this is ridiculous. And it took a year of work, and it ended up happening. And then the second one, I already knew what to do, and there was no trying, and it was one cycle. So it was like a year for the first one. Second was one cycle, and it's like, yeah, it was like natural. I was already doing all the things. I wasn't pressured,
Yeah.
and boom, it just happened. And that was it.
Yeah. Yeah.
Yeah, nice. Well, I'm curious, just kind of wrap up the treatment aspect of our conversation. Are there any supplements out there that you see have a high return on investment?
Supplements are kind of a funny thing. I believe as much like I'm going to get crucified for this. As much as there every supplement company is out there touting, "Oh, our supplement is the best for male fertility." In reality, it's a glorified multivitamin with a couple of herbs or like extra antioxidants. What I have seen in the data, I pulled very recently, I pulled about 6,000 studies to try and figure out why we were noticing what we were noticing, which is when we gave people a generalized male fertility supplement that I had created, right? I had put some thought and energy into it, like, oh, it hits on on all the factors: count, motility, morphology, testosterone. And what we were finding was that giving that supplement was causing some guys to come back with better count but worse morphology, or better morphology but worse count. Something was always yo-yoing. And I was like, this is not making sense to me. So I like went back to the research papers and did a very fancy chart. And what I realized was there are very specific herbs and nutrients that support morphology versus motility versus count versus testosterone. And I was like, oh shit, we've been thinking about this all wrong. When you
You're
put
just
all of
throwing
these
it all
things
together,
in
right?
one, it doesn't work. And you're hit like one is anti this other thing. So what I've started to do now is our count and motility were very close. So we put those two together. And then morphology and DNA frag are very close. So we put those two together. And then testosterone lives on its own. So now we have a system where if you have all the factors happening, then you're going to do the testosterone support first. Then you go in with the count and motility. Then you go in with morphology. And what we're seeing is way better results because now you have a focused support of energy on a specific issue that's actually going on for you, instead of trying to hit everything all at once, which was having a negative effect on something else. So,
wow, that's really fascinating.
yeah. So I've come to this realization very recently that we cannot give even men is not as simple as just take this and it's going to fix all your issues. It really is a personalized journey of figuring out what is it that you actually have going on and what do you need, rather than let's just try to give you all the things and hope that some of the spaghetti sticks on the wall, because that approach doesn't work anywhere else. Why would it work for men?
Well,
right?
But it is often sort of our approach, this kind of shotgun approach of like, hey, we have a lot of different things we're trying to approach here. Let's just load you up with a ton of supplements that affect all of them. But you're right, some of these are counteracting other ones. So I think that's brilliant. That's a great point to make. Mike, I'm kind of curious from a Chinese medicine perspective, what sort of insights do you have as far as infertility go?
Man, that's awesome. So it's something you just mentioned. We call it spray and pray in acupuncture, and it's like you're
you guys have the best phrases, I swear.
But really, it's like you're treating somebody, they come in with 100 things, and you're like, I'm just going to throw every needle into every point, and I'm just going to pray that something sticks. And it's often counterproductive. They come back and they're like, well, I'm super tired. I felt not great after the last treatment. I was sweaty. I don't know what's going on. It's like, well, I did put 50 needles in you for 40 minutes, so that could be it. But with fertility, a lot of what you're saying is right along the lines of what we see, especially for etiology, for contributing factors. It's like you're looking at lowering your stress, good diet, like clean environment where you're having good water, good food, good exercise, good movement, all of these things, which are counterproductive in some ways to our society currently. Because this is really the fight I see the most of all, is that you look at our society and what do we have? We overworked, we're underpaid, we don't rest enough, we sit on our butts for 9 hours in a row. We come home in our car, driving, sitting compressed. We get home, we have pizza or whatever was the easiest because we have, life and it's busy and it's tiring. And then you're like, okay, perform. Let's go. It's time to conceive. And then the body's like, no. How about no? And then we're like, why can't I get pregnant? And it's like, well, our whole lifestyle, going back to the testosterone, going back to everything we've talked about, like our modern lifestyle is not in line with conception. It's not in line with the body saying like, yes, we are ready to bring forth life. It's like, no, I'm stressed. I'm overworked. I got my nicotine. I got my alcohol. I got my caffeine. I got all my chemicals. I'm sitting on my butt. I'm overweight. I don't exercise at all. And now I want a healthy baby. And it's just it's not conducive. So I think, slowly changing those habits, which I've worked on for myself. I'm not criticizing anybody else because Dr. May worked with me on this. I've worked on it where, it's not the easy way. A lot of this stuff it's simple, but it's not easy because it's not matched with our society. And so I think taking one simple step at a time and realizing it's not easy, but it's simple. And you make your one change and you're like, I feel better.
Yeah.
I cut out this thing. I feel better.
Yeah.
Yeah,
That's a great
absolutely.
point. So, Dr. Aumatma, as we're kind of wrapping up here, I'm kind of curious as far as epigenetics goes, and I'm curious if you have that conversation, I'm sure you do, of the state of health of both the male and female at time of conception and what influence that has sort of epigenetically for their babies, in the long term as they become adults, and what kind of health issues that they have later on.
Yeah, absolutely. I think actually the research has shown that more of the male's health at the point of conception has a bigger impact on the child's future life than the females.
That's surprising. Yeah.
Yes. So, again, this idea that we just not ignore, we're going to ignore the guys is really not great for our society. It's not great for the future generations. And there are two factors, and we didn't get into this, but recurrent pregnancy loss is something that I've specialized in for a very long time. So we see a lot of those couples, and most of the time, 98% of the time, there are one of two or more factors going on the male side that are related to methylation detoxification. So they have some sort of SNPs that on the male side that are contributing to the woman having recurrent loss, and blood sugar and insulin on the male side contributing to the woman having losses. So here's this woman who's like, oh my God, another loss. I can't believe it. I'm such a bad parent, right?
Yeah, like feeling like it's all her fault. Yeah.
It's all of her fault.
Yeah.
But in fact, it's the male who is not the genes that are being contributed. And I don't know if we know exactly what is being passed on yet, but these factors on the male side have clearly been shown to be factors that are influencing whether or not this woman has a full-term pregnancy. So I feel like that, we have said it again and again today, but we absolutely need to prioritize male fertility and male health in general. And it's a sorely ignored part of our society. Men don't go to doctors until there's something major going on. So hopefully that is changing. Hopefully that dynamic is changing. And I certainly think that fertility is a really great time for, like, the number of times I've been like, oh, you're pre-diabetic. Should probably work on this now. Right. And he's like, but why? my doctor said I'm fine. And I'm
Mhm.
like, yeah, but your hemoglobin A1C is like a 6.0. Give it
Mhm.
3 more years, you'll be diabetic.
Yeah.
And
Yeah.
he's like, oh, well, I didn't realize it was that close. Like, yeah, not
Yeah.
only that, it's affecting her fertility, right? It's
Right.
affecting her ability to get pregnant and stay pregnant.
Yeah.
So
Well,
let's,
I see that a lot too, and I'm astonished at how many times I see women with recurrent pregnancy loss, and their husbands or their partner have not ever had a sperm analysis
Yep.
done. I'm like,
yeah,
Common.
what are you? What's going on here? you know.
yeah,
So yeah, you're right. There's just a huge disconnect there, and
Yeah.
all of that weight is placed on the woman. And from my perspective, like we had 2 pregnancy losses. It's an extreme amount of stress,
mhm,
especially the woman, because she does. I had my wife look at me and say, "What's wrong with me? Like,
yeah,
why am I losing these babies?" And she just carried the weight of that on herself, and
yeah,
that's really tough to see. And I mean, I didn't have answers for, even as a physician. So, I mean, that obviously that weight needs to be, carried by both
yeah,
partners. But now we know, like, it should be carried because it is. It's not just
yeah.
one person's fault.
It-
Yeah.
I feel like that's the cool thing about science is like the more research that we do on this stuff, the more we're like, oh, there's something we didn't realize.
Hmm.
Like,
Hmm.
oh, it's actually happening on the male side.
Yeah.
Yeah.
Uh,
Yeah. Yeah.
DNA fragmentation is another one that we didn't talk about, which
Hmm.
is like the head of the sperm and then the tail, and the first little third of the tail has the DNA. That fragmented just means like it's not ideal.
Hmm.
It's not in a healthy state. Uh, and that the DNA fragmentation tests have been shown to be the reason for embryo stagnation in IVF cycles. So embryos that don't develop past a certain day, they always arrest on day 3 or day 5. That's almost always a male factor issue.
Hmm.
And implantation failure, often correlated with DNA fragmentation, and recurrent pregnancy loss connected with DNA fragmentation.
Hmm.
So the research is there. What's interesting is that a lot of guys will get the message from their IVF doctors, oh, that doesn't have anything to do with it. We don't do DNA fragmentation because we don't believe in it. I'm like, how do you not believe in science? Like, here's
Oh
the
gosh.
data. Tell me
Yeah.
what it is you don't believe.
Right. It
Yeah.
just goes to show you, like, even in medicine and science, we still get kind of tunnel vision, and we get into sort of our own sort of routines of what we do and what we don't do. And I call it, it's a large ship with a small rudder. It just takes a long time to change that direction. But love that we
Yeah.
have providers out there like you that are helping all of us learn something a little different and keep moving forward. So,
Yeah.
um,
Thank you
yeah.
so much. That's awesome. And the last thing that I would say is, like, you've said it multiple times in this, and I completely agree. The words "it's fine" and "you're fine" are the most dangerous words in medicine. I hear it
Mhm.
every single day, multiple times a day. Doctor said it's fine. Doctor said I'm fine. Everything's fine. And it's so dangerous because it takes like any personal accountability and action out, because you're like, well, I was told I was fine. I'm a
Right.
healthy guy. Everything's fine. I just live my life. And it really does place the blame on other people, and it takes away your power. And so I'm really glad you mentioned that, because it's like, it's so important for people to realize, like, there's different levels of health. It's not about fine or not fine. It's like, let's get to optimal. How about that? Let's get to
Mhm.
Yeah.
optimal.
Yeah.
Yeah, absolutely. And I think it is, I am a believer that getting a second opinion is
Mm.
essential.
Mhm.
And that is so much of why I have been spending so much of my time creating this app that we're working
Oh,
on.
yeah.
It's
Yeah.
called madrefertility.com is where you can find the app. And there is a male version of the analysis because
Nice.
that was the one most requested thing from the women. They're like, what about the guys? What about my partner?
Yeah.
So we've spent the last year creating the male side.
Nice.
Uh, and we will analyze for free all of your data. So
Wow.
you
That's
upload
amazing.
your labs, you upload your sperm DNA frag, you upload your semen analysis, whatever information you have, you upload it alongside answering all of the questions. And the app will analyze for you as if it were me doing it. It's very accurate. It to my brain. It's what I would think if I was talking to you. And it will give you that second opinion essentially for free. So
Wow.
you can really get to the root a lot quicker. My hope is that we change this dynamic and for all of the people that are like, why isn't anyone telling me what's happening? You can go and get some answers without spending thousands of dollars, without more research, more appointments, more spending hours on Google trying to figure it out yourself.
Right.
And really hoping that can help people take action sooner rather than later, and to take the type of action that will hopefully not lead them down the path of having to do $200,000 worth of fertility treatments to get a baby.
Well, too,
And we are going to have that app in our description on all of our platforms. So please check it out. That's just an awesome tool. So we're going to have that everywhere. Make sure you go in there and take some charge. So go ahead, Dr.
Yeah. Well, I'm just going to say you're educating people, so you're giving them more resources, right? Which makes them better able to really push their providers and say, well, this is what I know. This is my information. And as a provider who's been pushed and challenged, I appreciate that. Maybe not in the moment, but I appreciate that. It makes me a better provider, right?
Yeah.
And so, we all, better educated patients make better educated providers too. So yeah, thank you. So along with that, with the app, what are some other ways that people can get in touch with you, hear more about like your education and all the books that you've written, all that kind of fun stuff?
Yeah, I think my Instagram is kind of my home. So at Holistic Fertility Doctor, it's where I hang out. You can message me, DM me, whatever. It's me responding, not some assistant. I do have a bot in there, but I will respond. I will eventually get to giving you a personal response. And so that's a good place for just connecting. And then Egg Meet Sperm is the podcast, free education. There's a YouTube channel with the same, and the book Fertility Secrets: What Your Doctor Didn't Tell You About Baby Making. There's only like a small chapter on male fertility. It's a lot focused on female fertility, but it is a really great like starting point for someone that's starting out and trying to like say what is this root cause, and like why do I need to know the root cause, and how do I figure it out? It's a good starting point for that.
Okay, awesome. Well, again, thank you so much for being on the podcast. I think this is going to really help a lot of guys and maybe open up some eyes that they had no idea like this was actually an issue. So thank you again. We really, really appreciate
it.
Yeah,
so glad to be here. Thank you both for having me, Dr. May and Mike.
All right.
Thank you for having me.
All right, guys. So you heard it. Like, if you guys have questions, please give them to us. We can pass those along to Dr. Aumatma as well. And so for now, this is the Forge Men's Health, and we'll see you next month. Take care.
Thanks.